Welcome to the Dr. Mary Lauder podcast show, where we explore the messy, magical, and deeply human journey of healing. I'm your host, Dr. Mary Lauder, a board-certified osteopathic physician, an accidental shaman, and a lifelong student of human experience. Together, we're going to talk medicine, wellness, and culture in a way that's grounded, perhaps maybe a bit cheeky, but always from the heart. And don't miss Gadgets, Gimmicks, and Gotchas, my reoccurring segment where we lovingly call out the fluff and highlight the stuff that actually works. So grab your favorite brew, coffee, matcha, or that mysteriously green smoothie and settle in. It's time to get this party started with a strong dose of soul medicine. Welcome to the Dr. Mary Lauder podcast show. We're glad that you're here. My guest today is Kelly Tuttle, and she interestingly joined something called the Head Injury Survivors Club. And that's something she described in 2015, which occurred, meaning the head injury occurred after she sustained injury from a car accident. And she didn't know for some time, about 3 months, that she actually had a brain injury because things just weren't computing. And so she walks us through her journey that way. And I think this is really important because it speaks a lot to injuries regarding concussions. It speaks a lot to how we can access and get care and get insight, and also how we can advocate for ourselves when something's not right after we've had an injury that could be similar to what Kelly describes. She's also a nurse practitioner, so we're going to talk at this a little bit from the healthcare perspective. So, welcome to the podcast, Kelly Tuttle. Well, welcome to our podcast, Kelly. It's lovely to have you. Thank you for sharing your time out of California with us here in Michigan. And I'm really excited and interested about your story. As you know, we're cohorts in the medical system. We've both had head injuries, but I'm gonna let your head injury lead 'cause, I think that is one of the things that's most important I wanna hear about and how this has impacted your life. And I think most importantly is really your perspective of what we can share with our listeners so they can become good advocates for themselves. So, welcome, and go ahead and tell us your story. What happened, actually?
Yes. Well, thank you for inviting me to share my story with your listeners. I really appreciate it. So, my story starts with a thunderous clap of metal and the shattering of glass, traffic stopping, people coming out of their homes to see what happened. I
Mm.
was driving home and another car pulled out in front of me on a rural road, and I was unable to stop in time before colliding. It was a pretty bad wreck. There were airbags deployed. My car was totaled, but I thought I'll just shake this off and get back to work.
Mm.
And I went to work the next day. A friend drove me, and my colleagues who were registered nurses and nurse practitioners noticed that there was something wrong. My speech was wrong. So they implored me to see my general practitioner the next day, which I did. And I was diagnosed with a concussion. And I left with a feeling that I'd be better in 2 weeks. I was taken off work for 2 weeks, and then I returned to work. I still had a lot of symptoms, from injuries from the car accident, dizziness, fatigue, irritability, um, that I didn't quite understand was related to the brain injury. And I pushed until one day, driving home from work, I fell asleep at the wheel.
Mm.
Fortunately, the car bouncing off the road woke me up in time before I hit a tree.
Mm.
And this is how well my brain was thinking. I have to keep going to work, so I'll just take a nap in between work and home on the side of the road, which is not safe, and I don't recommend for your listeners.
Yeah.
But that was my focus. And then fortunately, I had lunch with a colleague who was a neurology nurse practitioner at the time. I was a cardiology nurse practitioner. And she asked me how I was doing, and I mentioned falling asleep at the wheel, and it was okay because I was gonna take this nap, and she's like, no, that is not okay.
Mm.
You need to see a physical medicine and rehab doctor." and you need a brain scan. I hadn't had this done. We're almost 3 months out.
Mhm.
So I see the physical medicine rehab doctor who immediately recognizes a mild to moderate concussion and starts me on the road to recovery, takes me off work for 3 months so I can attend my physical therapy and get the rest and so forth that I need to heal. And then it was 2 weeks before I had to go back to work that I was freaking out. I was like, "What does my brain need to be supported so that I could be a good employee and take care of my patients safely and effectively?" And I looked at all my books and internet, therapist handouts, nothing was specific for going back to work. And I just remember thinking, I don't want anybody to go through this. I don't, this is terrible because I could barely read and remember anything after 5 to 10 minutes at the time. So it was killing me to try to put this knowledge together. So when I did decide to write a book, I wanted it to be straight to the point with strategies and tools that worked for me to help me go back to work. And then I made it for Audible because it was really hard for me to read for a long time after my brain injury. And Audible books were my savior. And I wanted my book also to be available on Audible for those who were having a hard time reading too.
Yeah. Wow, that's quite a story. So, when you had that first accident, without trying to evoke any traumatic feelings here, did you get knocked out?
I believe that, everyone thinks so, because I remember my car being straight, and then the next thing I remember is it had been facing to the left, and I don't remember how that happened.
Okay.
Mhm.
Interestingly, that's interesting, and but you don't remember, like, coming to or anything like that, any type of sensation like that of, "Gosh, where am I?" type thing, or
Well, I remember the, painful punch of the airbags.
yeah.
You know, I felt like I was punched in the face and the chest by Jet Li.
Yeah.
And, and I remember not being able to move for a really long time, just sitting there and wanting to grab my phone to call for help, to turn off my engine.
Mm.
But I couldn't move. I was like stunned.
Yeah. Yeah. Yeah, it's interesting, the reason I bring that point up is, when we look at folks who have concussions, your story is very typical. We didn't go to the physician right away, didn't go get an evaluation, kinda went back to work the next day. I'm doing okay, I'm upright, I know how to make my sandwich, whatever. And so, I think so many times our brain injuries get um, under-evaluated, non-identified, and often unseen. And I think that that's really important. And then I know that people say, well, I didn't lose consciousness at the site. No, I remember what happened. No, I was able to walk around. Well, the reason you were able to walk around was because you were in shock. And there was so much adrenaline, you're going to be able to probably lift the car off someone should you need to.
Right.
And, so it's interesting to hear that and then to know that, for our listeners to know that no matter what, it's always good to go get evaluated. The thing that's interesting when they start that evaluation, if you were to go to an urgent care, they go, "Oh, yeah, you have a concussion. Nice to see you. Bye. Can we have your copay?" Right? It
Mhm.
would be
Right.
kinda small and
Yes.
it's not to be critical, but because it's under-recognized, the amount of trauma because it's not seen, you're not bleeding, sometimes you might be bleeding, but you're not head's not cut open, arm's not gashed, and so that is a thing, and I don't think in the urgent care setting, or even sometimes in the emergency room setting, they really evaluate the mechanism of injury.
Mm-mm.
You T-boned somebody, right?
Mhm.
Or you get T-boned. Or you hit one car, spin, hit another car, spin, hit a post. That's
Mhm.
3 injuries, 3 different potential impacts, right?
Exactly. Yeah.
So, I think it's really important that we understand that oftentimes from the get-go, these injuries aren't identified correctly.
Yeah, and I saw that with my patients in practice that I would hear of a patient who was in a car accident. It was a pretty bad car accident that the car seat shifted onto his lap. He was in the back seat. He broke his femur and got care for the femur. He had a history at military service, and then he's in this really bad car accident. And then 6 months later, he attempts to end his life. And I'm thinking that he should have been caught for the brain injury
Right.
and been getting therapy and monitored for development of anxiety and depression, which can happen after a concussion. And then that could have been prevented. But because the focus was more on the femur, the head injury was not investigated or followed up on.
Mhm.
And that was the other thing, too. Like when I was a patient and I was sent home, 2 weeks, you should be better. This is what patients hear. Let me know if anything gets worse. Well, if you don't have self awareness, which I didn't have for quite a while after my brain injury, you don't know if you're getting worse. You don't know your limits. You're just going forward with life. And then you can put yourself in danger, like myself, falling asleep at the wheel. And so, as a provider, when I was faced with someone who I suspected a concussion, I followed them up with 2 weeks, followed them up in another 2 weeks. Well, so we're 1 month out. Then I'm gonna follow them up in another month, every 3 months for 6 months, every 6 months for a year, and then every year after that, just in case something develops that
Mhm.
might be missed.
Yeah. Yeah, I think that's really important. And oftentimes patients don't get imaged. And
Right.
so then they say, well, what are we going to do? Well, great question, but you have a baseline.
Yes.
Neural evaluation, you have a baseline. It would be, and really does this fall under advanced trauma life support, ATLS, which is really protocol driven. And for our listeners, that is literally a set of standards that, depending upon what the trauma is, and this was developed on the battlefield and tested there, and it's probably one of our best approaches to trauma in America, in our hospitals and EMT and emergency settings, is if this happens, this kind of trauma, like a car accident at this speed, here's are the steps you literally need to do.
Mhm.
And I would suspect if you're on a rural road, you weren't going slow.
Mm-mm.
And
At least 45 miles per hour.
yeah. And I remember working in a rural emergency room out west. And one of my first days, a gentleman rolled his car at 70 with no seatbelt on.
Oh my god.
And he was walking around at this off the edge of the highway, and he didn't wanna come to the ER, and so the EMT folks were calling me at the ER and said, "Well, he doesn't really wanna come in." I just go, "ATLS says he has to come in." I didn't know what else to say, I was brand new, and he came in and he was, like, kinda jawing about it, and on he went, and I said, "I appreciate all that, sir, but I'm just gonna adhere to the standard of care because I think you deserve that." And lo and behold, 45 minutes later, as we're rolling him to the CAT scan, which we all know is the tunnel of doom, then he started crashing.
Mm.
And so you can only imagine what I was like, "Oh my god." And so we had to helicopter him out of there, stabilize him, and because we were in a rural setting, but he was walking around at sea,
Right.
you know? And
Mhm.
so, um E e so it's really, really important for anybody who has a head injury to not listen to anyone else and to go and have an evaluation. I think that's the most important thing. Um,
Exactly.
yeah, yeah. So, okay, so we've got that because I think that that's a really good, even a maybe even a public service announcement for our listeners. And when that happened though, and you were not just getting back to work. You mentioned, but the emotional component. Share with me a little bit what you saw, if you saw anxiety develop or other symptoms, ADD, ADHD. What did you notice?
Well, initially, I think I had some PTSD, because I had, fear of driving, a lot of anxiety of getting in a car
Mhm.
for a couple of months, and, I had, nightmares about car accidents, for years afterwards.
Yeah, sure.
Um, there was the first few months I was more emotional than normal,
Mhm,
so a lot of crying, a lot of cuss words that I wouldn't have normally said. And then for, like, the year after, I had problems with impulse, so, I had some impulse spending, but I also, would insist on proving a point in an argument or a discussion, which I normally wouldn't have.
mhm,
And, it took me, several years to, develop back my inner peace,
mm,
where I could sit through a stressful meeting and maintain my inner peace, my clarity, and perspective. I lost that, and that, I think hurt some of my credibility with my colleagues,
mhm,
um, after that car accident. And then there was a sense of, I would look in the mirror and I would see myself, my reflection, and I wouldn't know the person inside. I didn't know who I was. I had personality changes. Um, I had to change when I sat down and really thought about it. I found my values had changed, my lifestyle had drastically changed. And so there was a lot of having to have develop a growth mindset and emotional intelligence. And I did most of that through journaling and mindfulness.
mhm,
But yeah, it was a long struggle. It was a dark time when I actually look back on it. I have to admit that it was a very, very dark and lonely time. But I just made baby steps every day to try to get better.
mhm. Wow, that's thank you for being so vulnerable sharing that. Because 'cause I'll bet people experience that, but don't often voice that. Um, what do you think are in that time that you were experiencing those emotions and feelings and, changes and detachment and dissociation is really kind of what some of that is. Not to, get over analytical here, but what clues did people miss that could have been helpful to you as a loved one or a close friend? Anything that could have been beneficial for you that people just didn't pick up on?
No, I had very I this is why I feel really lucky and grateful. I had friends and family that were super intuitive, and they knew stuff before I even realized it. Like I went to a party with some friends, was sitting at a table, there's all our friends around the table, they're being loud and boisterous. And one of my friends, he catches my eye and he goes, "Are you starting to feel overwhelmed, Kelly? Do you need a break? Are we being too loud?"
Mhm.
I mean, how supportful is that? And then,
Yeah.
my husband, basically had to quit his job to take over the childcare and the household chores just so I could get to work because in order to keep working, because I was the main income earner and benefit carrier, I would go to work, come, take a nap on my lunch break in my car. Then I would come home, take a 2 hour nap, get up for an hour to get ready for the next day, then go to bed until the next day. And then I would sleep 12 to 14 hours on the weekend, sometimes with a nap. And
Wow.
that was the first 2 years just to get me to work, keep the roof on our heads and food on the table.
Wow.
So it was, I had a lot of support
Mhm.
to kind of get through that and make that possible.
Well, I'm glad that you did. I'm glad that that part was in place even, with as difficult as that was. So, let's switch lanes and go down healthcare lane. What happened there? What were you seen? Were you believed? Did they figure it out? Or they go, "Oh yeah, no, you'll be fine someday. Nice to see you. Pay your copay. See you again."
It was really bad. Oh, so I ended up having to hire a lawyer because my car insurance told me they didn't have time to call California to get my medical records. And I was really worried about being left with a huge medical bill
Mhm.
after everything was settled. So I decided to hire a lawyer. And once I hired a lawyer, I didn't realize I had someone in my corner fighting for me, not only just for the car accident, but
Mhm.
to get the care that I needed. And at one point, my husband says, "Your lawyer cares more about you getting better than your doctor." And it's true because there's a lot of misinformation at the front lines. A lot, as we know, research takes quite a while to get to the frontline clinician. And so it was really difficult to get a head CT or an MRI. I didn't get an MRI for 6 months.
Mm.
My T3 MRI initially had that copper staining. I forget what the medical term was.
Mhm.
And my doctor said, the neurologist said, "Oh, it's just a non-specific change." And I'm like, there's copper in blood cells. I think I had a little bit of bleeding. And it wasn't so then through so I just got kind of basic care that is really limited, I think,
Mhm.
in my opinion, from that was covered under my insurance. So I had a huge financial impact seeing specialists and paying out of pocket. And one of them was a neurobehavioralist.
Mhm.
He did a functional MRI. He saw that one of my ventricles was larger than the other.
Mm.
So there were structural changes. And he was the one that sent me to be evaluated for sound sensitivity and uh, binocular vision dysfunction,
Mhm.
which made a huge impact on my healing because once that was treated, this I controlled the sound sensitivity and had my vision corrected. My headaches went away. I had
Mm.
more energy. I was tilting my head to the right in order to see the world and read. My neck pain got better. It was a huge impact. That was not from my general practitioner. It wasn't from my physical medicine rehab doctor or the neurologist.
Mhm. Not even the neurologist.
No, the neurologists are like not the best people to see for brain injuries.
Our
And
apologies
I
to anyone who knows a
Yeah.
neurology.
Yes, I know there's some that are real passionate, but a general neurologist, really just as you know, I'm saying this for your listeners,
Yeah.
is sees patients for brain diseases, not injuries. So they're going to see patients for Parkinson's, multiple sclerosis, epilepsy, those kinds of things. And so they can help you maybe with your headache management, with your post-traumatic headaches. But they're not really knowledgeable about brain injuries and the current therapies and treatment that would best support your symptoms. So you may be disappointed if you
Right.
do see a
Well,
neurologist.
yeah, and it's interesting because everybody says, "Get to the neurologist, get to the neurologist."
Yes.
And, and uh I just think of the times that I've cared for folks in urgent care, and we've, as soon as they were concussed, we knew they were concussed because they would come in, but we put them in a dark room. I did X-rays of the neck. Of course, we didn't have CAT scans where I was. It was, outpatient, but getting them into the right person quickly, and also, that management of exposure to screens, TVs, phones, reading, and back and forth and resting, I think is so confusing because what you hear is don't do anything, don't go back to your activities till your headache goes away. Your headache may never go away. And it
Hmm.
and and so that's not exactly true. And what we know, with the change in the cells, the oxygen and the inflammation and leakage of glucose and sugar and inflammation, all the stuff that goes on, there's also key ingredients that the brain needs for nutrients. And those could be, without, being very specific, essential fatty acids, anti-inflammatories, things like that, that the brain,
Antioxidants.
and
Yeah.
yeah, antioxidants because the oxidative damage of the
Yes.
and then, and then, just understanding that whole concept of everybody has a screen and you probably need to stay off of it 'cause you're scrolling, scrolling, scrolling. Your brain is just going and there's no rest.
Mhm.
So did you get any insight on screen usage and things like that? How did you navigate that?
So I learned from a recovery book about screens and managing that, and I learned about blue light, and I was sensitive to blue light. And I also had difficulty with eye tracking.
Mhm,
And so every time I scrolled up and down on a computer or my iPhone, I wanted to throw up.
mhm,
So
mhm,
um, what I had to do was slowly just do like 5-minute increments
mhm,
of screen usage. And, for a long time, just avoided extra, so I didn't watch TV. I used blue light. This was before blue light technology, but, I used blue light blocking filters on my computer screens and on my iPhone, and I would wear the glasses, and those I felt for me were really helpful. And then I did see, referral to a, neurology therapist, a neurotherapist, I'm sorry, and she helped me with, my eye tracking, and so, I did work on that, and that was helpful. But it took even now, I can't really look at my phone and flip through it like I used to,
yeah.
before the car accident.
I think that's a really important point because I think the changes I wonder, we know that there's the injury to the brain, but I also wonder if that functional level change that might not be validated, understood, or even seen contributes to some of the mental and emotional health issues that follow a brain injury. What are your thoughts on that?
Oh, I think so greatly. I think there's a lot of anxiety, especially if you are someone who has to work on computers for work or uses a work iPhone, or you're at a register and you have that computer screen.
Mhm.
And it is really we take for granted what our brains do for us and our eyes, and it takes a lot to be able to look at a screen, filter through the light, read, without any eye gaze support, um, while you're reading off the screen. And, yeah, it's really difficult, but there are things that you can do to, help support your brain, while it's not tolerating the screen time. And using those support tools and taking intermittent breaks while you're at work or working on the screen, over time, your brain, as it heals, will have more energy to tolerate it.
Mm. Okay. Yeah, so it really is a rehab and rebuilding of that. Yeah.
Yeah.
Sometimes we hear people have to relearn things. Um, reading, comprehension techniques. Did you find that that was something that would you had to relearn or what was your experience?
I lost those things that are automatic routines.
Mm,
So getting dressed or prepping for a patient. And so in order to make sure I didn't miss a step, I created what I called check off lists, or it could just be a checklist.
mhm,
And it would have squares and I would check off as I went through the process. Like I brushed my teeth, I put my deodorant on, I did my hair, I dressed, I put my jewelry on. So I did a lot of that
mhm,
for a long time until those things became routine again.
mhm,
And then when I would see my patient, I had to I had my checkoff list. I um, looked and checked these labs, and then I looked for this test, and I, reviewed the chart and made sure that this was okay before I went and saw them. So I did rely on external memory tools for quite a bit,
mhm,
not only to not just miss a step, but also it helped limit the drain of energy it takes to make decisions to make that next step, that
mm,
next step. And so it really, to me, it felt like it just lightened my mental load to just rely on that checkoff list and not rely on having to put that unnecessary burden on my brain so I could save the energy in the morning for work instead of just getting ready for the day.
Gotcha. Gotcha. Wow, that's just super, super fascinating. Um, so I had a concussion in high school. I went over the handlebars of my bike, was knocked out. And then
Oh
they
my
a
goodness.
very kind man pulled me out of the street, propped me against the telephone pole. It's a good thing I didn't have a broken neck because those were the before helmet days, and I just kept saying my name over and over again, "What's your name? Mary Mark. Where do you live? Hadley Street. Who's your parents? Joe and Henrietta, 3636967." And within, like, 3 probably 5 minutes, my parents were there. We were, and then I went in an ambulance and all the way down the hospital. I remember this. I remember going over the handlebars and then I don't remember anything else. Then I remember waking up on the telephone pole. And then I remember being in the hospital, and I remember getting sick in X-ray, and I was so embarrassed I was sick. And I didn't throw up, I kept swallowing, it was horrible, but I was scared, I was a kid, and there
Mhm.
wasn't anybody with me, and I just remember X-ray took for I don't know why I was there forever, and but I remember then the following year, so I was between my sophomore and junior year of high school, I, went from algebra to geometry, and I'd sit in geometry class, I'm like, "Oh, that makes great sense, I really love this, da, da, da." I get home, I couldn't do geometry. Mm. And I literally couldn't make sense of the theorems and the things I had to prove. I and then I I looked at my report card not too long ago, it was like D plus. I think that was a mercy grade, and I just couldn't pull things together. That year before, we did all those standardized tests, and I got really high in spatial relations, and then I flunked geometry, and so my teachers got upset with me, said I was goofing off. And not applying myself and too chatty and all this kind of stuff, and it took till I got into residency and did a neuro psych test, and they found an area in my brain that had to do with spatial relationships that showed damage, and I'm like, "Yeah, that was the concussion." And so,
Mhm.
we'll talk about your rehab, process, but for me, the rehab that worked, I'm an osteopath, and I had cranial sacral therapy. And I started doing a lot of things, left hemisphere, left hemisphere, right hemisphere, and I just forced myself to do that, like, I would treat a patient osteopathically, I knew the mechanics, but then I would just go into my right brain treating them, and, being just following the body and the things that we learned to do, and then I would sit down and I would document it. Sit down and do the charges, and so then I was back in my left brain. And I think it took, I would say, a good couple of years, and then I felt and have pretty good evidence of the reintegration back and forth, but we never knew way back then what happened, you know? And it actually made me apprehensive about going into a few different specialties because I wasn't sure I had the spatial relationship understanding.
Mhm.
So these things are super big impacts on people. And then I felt ashamed because I didn't know why I lost it. I had no idea it was connected to that concussion until I was in residency. No idea whatsoever.
Yeah.
And so, so speak a little bit about your rehab once you got on the track and figured all that out, what that looked like for you.
It uh, so I found speech therapy the biggest help. And, I did have some aphasia, um, and but mostly the speech therapy was for cognitive functioning. So I had really difficulty with my, higher executive functions.
Mhm.
I had difficulty with initiation, motivation, planning. I used to be the party planner in our family, and
Mm.
I couldn't even remember to buy a birthday card. So
Oh, wow. Oh my goodness. Oh my goodness.
yes,
Oh my
I used
goodness.
I was the big planner, and so, yeah, there was a moment that it was, like, 5 days before our youngest birthday, and I told my husband, I can't plan it. I just can't get my brain around it." And so he took over, and he actually turned out to be the better planner than me anyway.
Oh, no. That's a that's a good thing, I think.
Yes. So, yeah, it was, it kinda started out at ground zero, difficulty with paying bills. I would, get my mail and, it would just overwhelm me. I would just stand there at the kitchen counter staring at it and not know why I couldn't move. So I started hiding it in paper bag, and then the bills got paid late, and
Oh, yeah.
lots of fees and penalties and so forth. So, definitely speech therapy helped me with that, like, taking large projects and breaking down in small steps and taking breaks in between the steps. Um, Fantastic help with that. Um, but I think overall, what really helped me in my recovery was my curiosity was still intact in the sense of wanting to learn about the brain. And so, 2 years after the car accident, I changed my career. I went from cardiology nurse practitioner to neurology nurse practitioner. I read and trained and took CEs and all this stuff to try to qualify, and I qualified for a training position so I could come into the position with 0 experience. And, I followed neurologists, for a year, to 2 years intensely learning about neurology.
Nice.
Yeah, and I think that really helped a lot with my recovery,
Mhm.
with that learning that new thing. And then, after that, 2020 hit, and I had a break in my life and I had a decision. I could go back to school and get my doctorate, um, or I could write a book. And I decided to write the book. And in writing the book, there's a lot of learning because, I couldn't write before I started writing my book. I mean, the only writing I did was charting, and that's some boring reading.
Mhm. It is. It is. ROMWNL TNTC. Yeah, uh-huh, I get it.
Yeah.
Yeah.
So then I was learning how to write.
Yeah.
I was learning about the book business. I was learning how to share documents on Google Share. I mean, things I never did. How to manage social media, um, how to put together a business. I think all of that learning and along the way, supporting my growth mindset by reading books that supported that and my
Mhm.
emotional intelligence and exercising, starting yoga.
That's a key, that's very important. Yes.
Yeah, I think all of that accumulated to helping me with my rehab. So I don't remember doing anything specific in rehab, but kind of this tiny, tiny steps to expanding what I was using and demanding on my brain.
Gotcha. That's fascinating. So, yeah, so what I'm hearing is I made my life a hobby, and in finding my hobby, I got my life. Something like that, right?
Yeah.
Yeah.
Yes.
Oh, that's just really cool because I think people often, get discouraged, and I mean, it would take a great amount of courage to look at this and find an opportunity. It really would. It would take a great amount of you said you didn't quite have the self-awareness, but you had friends who had awareness for you. So it's so amazing that you had such a loving support system that maybe sometimes felt like they were pulling you up by your shorts or something, but they were, they had that ability to relate to you in such a level. And you had that level of trust with them that you were able to respond. And so that's a, really beautiful community and cohort, a group that you had that was so wonderful. Uh,
Yes.
So it does take a
Definitely.
village is what you're saying.
It definitely does.
Yeah.
And if you don't have that village, you need to find it, whether that is through support groups,
Yeah.
whether virtual or in person, or just, finding really truly trusted friends and family, and being okay letting go of those that aren't supportive.
Uh,
Because you already have negative Nancy and Bobby bullying your head, telling you're not good enough.
yeah.
You don't need other people adding to that audience. So if
Right.
someone's not being supportive for you, bringing you the things that you need into your life, you need to be okay to let them go.
Okay. That's amazing. That's really good insight. Well, for our listeners, Kelly has written a book called After the Crash. And I was thinking of, and the book is available at indie bookstores. The book is available on Amazon, Barnes and Noble, all the different sites that you can go to and purchase it. And she wrote the book in 2023, looks like. Yes, yeah.
Yes.
And so, and as I understand, it's a book, not just a little bit with your story, but how you navigated it and tools for people to use so they can recover their life after this type of injury. The
Exactly. To get back to work and to get back to life.
Yes, so if you were to go 2020 vision backwards, what would be the thing you wish you knew then that you know now that you could share with our listeners?
That even though your goals are huge, when you don't look at the horizon but watch your feet and just take those tiny steps,
Mm.
amazing things will happen.
Oh, that's
And yeah, I mean, it really my recovery went from not being able to make toast and coffee at the same time because I would forget about the toast or I would lose my coffee mug. It's really funny. My husband was like, "Why is all this dried up bread in my toaster?" Um, I went from that to writing a book and having a YouTube channel and writing for Substack and creating content to help others. And so you can do it too. It's just those baby steps. Break it down and just be persistent and you'll get there.
okay. That's beautiful. That's really good advice. Thank you. Thank you. And I appreciate how you've shared your journey with us today. I found your story very inspiring. And as a fellow concussee, I guess it would be, I certainly understand, what to some level, what you've experienced as well. And so thank you. And I'm just so happy that it, really was an event that was, well, a difficult turn of events turned out to be something that you were able to make into a beautiful chapter of your life. So thank you for sharing that with us. We really, really appreciate it.
It was my pleasure.
Thank you. We're glad that you were here today with our special guest, Kelly Tuttle, talking about traumatic brain injuries and how that can impact your life. If you like this podcast episode, rate and review it for us so we can get some extra exposure. We always appreciate that. Also, send us ideas of podcasts you'd like to hear, or simply just give us some feedback. That's always good to hear as well. Thank you again. We'll see you next time on the Dr. Mary Lauder Podcast Show. Have a great day. That's a wrap for this episode of the Dr. Mary Lauder Podcast Show. I hope you've heard something today that made you think, laugh, or say, well, now that was a plot twist I didn't expect. Just remember, your health journey is more than lab results and supplements. It's spirit, soul, and story, and sometimes a gadget or two you probably should have returned. If you enjoyed the show, please rate and review us wherever you listen to your podcasts. And please share our podcast with someone you love. If you didn't like the show, well, maybe don't tell anybody then. And if you want more soulful medicine, curious conversations, and tools that actually help, visit me anytime at drmarylauder.com. Until next time, stay kind and stay curious. Music today is provided by Mr. Dave Evans. He composed, played, and engineered this song specifically for our podcast, and it's called Soul Strings, an acoustic reflection of the healing path. Thanks, Dave. It's great music.